Welcome to Thursday Thought Leaders with Harbinder Narula for BW Healthcare World. My guest today is Stephen Flynn, who's the president APAC for a company that has recently been spun off from Baxter, focusing on kidney care. And this company is called Vantive. And Stephen, for your information, is someone who's been with Baxter for 19 years. Uh, Recently ran, for 7 years, Baxter's business in New Zealand and Australia, and then was promoted at a regional role at APAC. And recently, he's taken over as the head of Vantive. Thank you so much for joining us, Stephen, today.
No, my pleasure, and thank you for having us. It's great to be able to talk about our standalone company, Vantive.
Absolutely. So, Stephen, let me begin with asking you, how big is the burden for kidney-related conditions that we see in the APAC region, the region that you have been managing for some time? And more specifically for India, I know you were visiting India recently, and what is the market size that you see as a potential for companies like Vantive to address?
Yeah, look, the rates for chronic kidney disease continue to increase globally, and India is no exception there. It's estimated that 10% of the population worldwide is affected from chronic kidney disease, with around about 2 million people worldwide receiving dialysis or recipients of kidney transplants. If we look specifically at India, we're seeing about 2,200 new patients enter end-stage renal disease every year. In terms of market size, depending on the dialysis, that would equate to roughly an additional 34 million dialysis sessions every year. Is what we're seeing added to the Indian market. Look, at Vantive, we have a 70-year legacy of leadership in dialysis care. And as a new standalone company, we want to really improve access to the innovation and clinical care for these patients with end-stage kidney disease.
And Stephen, what do you expect out of India? I mean, from the business perspective, what percentage do you think will contribute to the global expected business for Vantive?
Yeah, look, if we look at Vantive as a standalone entity, it's a $4 billion business globally, and it's really quite equally split across the three regions. If we look at the Americas, Europe, Middle East, and Africa, and then Asia Pacific. India at this stage, because we really focus very much on home peritoneal dialysis, that is a much smaller segment, and we can talk about that of the Indian market. So it plays a smaller role for us now, but we really want to dream big in India. And we believe that home therapy, there's very much a global trend towards that. And we see it as a very good fit in India. And that's really the work that we need to do with the government, with the insurers, to really show the value of the home PD therapy and some of the modern technology that we have to bring to the Indian market.
So, I want to go a little deeper into this particular aspect. When you're talking about the opportunity, how is the demand for dialysis and kidney therapies, uh, therapy that services evolving? Because there are a lot of people, the patient burden is growing, and then the way the therapy is accessed is changing. I mean, right from being a part of a larger hospital, now you have specific centers, and now we are talking of home therapies. How are the emerging trends in nephrology care that you are looking at?
Yeah, so you're right. there's an increasing rate of end-stage renal disease. And this is really demanding new models of dialysis care. So if we focus on India, in-center hemodialysis has been the primary therapy, and it represents about 70% of the dialysis in India. 12% is the home-based peritoneal dialysis, and then there's about 18% transplantation. There is, as I said previously, there's an increasing trend towards home-based dialysis globally, and we can point to a few markets. In our region of Asia Pacific, Hong Kong continues to be a real leader here with their PD first policy, and they have about 80% home PD. While other countries in the region, my home country of Australia was sitting at around that 20 to 30% for home-based PD. So we do see variances around the world. And again, as the innovator of home-based peritoneal dialysis, it's really our obligation to show the value and benefits of this. One of the things we did while we were in India last week at the World Congress of Nephrology is we actually connected a number of the Indian nephrologists with the Thai nephrologists. And recently in Thailand, the government announced a PD first policy in acknowledgement of the need to improve access, really drive those clinical outcomes, and help with the economic burden that this disease brings to the nation. It was great at the World Congress of Nephrology, a real honor for us to bring together the stakeholders from across India, Thailand, to share learnings of that recent PD First policy announcement in Thailand, with a goal to discuss opportunities for similar policies or approaches, similar programs for India.
And Stephen, how are the therapies and digital solutions being offered by Vantive different from what already exists in the market? How do these therapies and solutions creating the innovation for what you're offering?
Yeah, well, I mentioned before, we have a 70-year legacy. So we were part of Baxter's kidney care segment, which included our kidney care dialysis business as well as our acute therapies business. And then in February of this year, so just a few weeks back, we became a standalone private company named Vantive, and we're owned by the Carlyle Group. And our mission as a standalone company is really to extend lives and expand possibilities for these communities. We're present in over 100 countries around the world, and we estimate that the people that we serve touch our solutions and services over 1 million times each day. So the Vantive legacy, if I really think about India, it dates back to 1997 when Baxter, the kidney care segment of Baxter, launched the peritoneal dialysis in the Indian market. And we service about 4,000 Indian patients currently. Most of those, the majority of those, on home peritoneal dialysis. I think where we differentiate, if you look at the Vantive V, we're really putting the patient in the middle, and at the tip of the V is our therapy, and our real strong focus and heritage of being the innovator in these therapies. And then the two arms really is where we're trying to drive the innovation, and they are around our digital offering and the services. So Vantive delivers really innovative products that are digitally enhanced solutions and looking at advanced services. And this is really about supporting dialysis at the home and in the clinic, as well as in our critical care therapy to support kidney and other vital organs in the intensive care unit or ICU of the hospital. So It's really about optimizing the care quality and efficiency with digital solutions. With our home peritoneal dialysis solution, we on our latest cycler for automated peritoneal dialysis, we have ShareSource, which is a connectivity platform, two-way, for home dialysis, and that really enables us to help the clinicians and the patients connect. So it is that digital solution that's driving a lot of the innovation for us. And that enables that very important remote patient monitoring. Um, we also really look at the services that we wrap around the therapy, and preserving patients' freedom with home dialysis is really important to us. So our automated peritoneal dialysis products, including Home Choice, Claria, APD system, really is strengthened by ShareSource remote patient monitoring and allows the patients to dialyse at night, giving them a lot more freedom to live their life to the fullest during the day. Um, in hemodialysis, we've innovated and we've brought about expanded hemodialysis, or HDX, and this is enabled by a very specialised dialyser, Theranova, and we've brought hemodialysis one step closer to the natural kidney with this innovation. And then if I talk about our multi-organ support business, or our ICU business in the hospital, where we're advancing life-saving critical care therapies with system capability of delivering not only continuous renal replacement therapy, or CRRT, but also we're expanding into multi-organ support. And last week, at the World Congress of Nephrology in India, we launched our CO2 removal system, which is part of that Prismax monitoring system that we launched a year earlier in India. So there's some of the ways our innovations are helping with patients. And what I would say, and certainly what we're hoping to drive as part of the focused business now, is to really ramp up and drive further innovation and R&D.
Absolutely, Stephen. And you come from a background of Baxter, where innovation is at the key. Uh, but when you're looking at India, and from the perspective of what the government of India is expecting companies to do, is to invest in R&D and manufacturing in India. Do you think this is something which is on the cards when Vantive is looking at India?
Well, we're very well placed on the R&D front. So today, as Vantive, we employ more than 850 staff in India across two locations. We have R&D, technical service, and our commercial offices in two sites, one in Gurgaon and one in Bangalore. And Bangalore is our global largest hub for R&D. So we're well established there. Look, as a leader in kidney care and other vital organ support, we really look to collaborate with the medical societies in critical care and nephrology, and really seek the perspective of these clinical leaders to service our patients and drive that innovation. In 2023, we provided nearly $2 million to support investigator-initiated research studies. And in addition, our medical group is funding independent medical education to provide organisations and to really drive that clinical research, which is very important to us as a therapy company. So we see really genuine opportunities to expand our business in India. The team there is really dreaming big. There's a lot of unmet need for patients, and I think we're well positioned we're really there listening, and we want to drive the therapy forward in a quality way to be able to meet that very significant unmet need in India.
And Stephen, when you were setting up Vantive as a separate company, and were there any regulatory barriers that you feel need to be addressed, or is there a wish list that you have, which you want to put it in front as an ask from the government as a global company looking at this space of kidney care in India that could impact the lives of people here?
India has shown some really good continued momentum to evolving its policies to help increase access to innovation in dialysis care. I'd probably point to the Pradhan Matra National Dialysis Program, PMNDP, which was launched back in 2016-17 and looking to ensure availability of dialysis services free of cost to the below poverty line beneficiaries at the district hospitals in the country. Now, this is really very much focused on hemodialysis services that are operating in the private-public partnership model. I think we have that across 14 states, in-house models in about 16 states, and then a bit of a hybrid model in about 6 states of India. Also, the National Health Mission under the government of India supports establishment of dialysis centres, in-house, public-private partnership, and those hybrid models. Again, really focused on HD service delivery and delivered by the state. One of the things that we're really talking to government about and looking for further support on. And, last week at the annual World Congress of Nephrology event in India, we were really proud to partner with the International Society of Peritoneal Dialysis to advance their home dialysis consortium manifesto. And this manifesto is really about advocating for home dialysis globally and more home dialysis. We think it's better for patients. It gives them more ability to live a fulfilling life and contribute economically to the nation if they're able to. So our ask to government is to continue the forward momentum that we've seen and work with the clinical groups such as ISPD and really look to advance home dialysis as a sustainable, more cost-effective model of dialysis care in India.
So, Stephen, since you brought up the affordable aspect, do you think in India the insurance sector, the way it works, also needs to evolve to ensure better care at home for dialysis?
Yeah, I think there is always more work we can do to empower patients and their care teams. In India, PD, peritoneal dialysis, is covered under the private insurance, but it is currently designed with a number of exclusion criteria that do limit access. So it's certainly something we can look at and work on. We see new models of home dialysis care and innovation helping insurers to manage the burden of this chronic disease and create more attractive programs to their customers. And again, I would call on the innovation here. So, Vantive's remote patient management technology that we have on the latest Cycler share source, there's a real opportunity there, I think, for private insurance companies to reduce the costs of clinical care through less in-center dialysis and less staffing requirements, less of the capex and building costs that are required here as we move the therapy to home, and really educate the patients and make them feel comfortable that it's a therapy that they can manage for themselves.
And Stephen, what type of support uh, are you at Vantive providing to the clinicians or intending to provide to the clinicians in the intensive care setting to ensure not only better outcomes, but even creating helping them create an environment to have happier patients.
Yeah. Look, building on our nearly 30 years of expertise in therapies used in the ICU, we've advanced critical care therapies with systems capability to support both kidney and other organs. So our aspiration here is to become a multi-organ therapy company. At a time, what we see is, in the COVID time and post-COVID, hospital resources are really stretched thin, and particularly in critical care, the most sickest of sick patients, and it's complex. And a number of our digital technologies, including TrueView, it helps to bring greater efficiency and proactive management support to the ICU and to those critical care doctors and nurses. At last week's World Congress of Nephrology, we very proudly launched Prisma Lung Plus. And this is a filter that goes onto our Prismax monitor, and it's our first step into that vital organ therapy because it supports extracorporeal CO2 removal from the blood. So it's innovations like that that are really going to drive better care possible for clinicians in the ICU. These tools, we have the one monitor that's now able to do multi-organ therapy. And as you know, in that ICU space, the real estate around the patient is really critical. But more importantly, making it a very simple therapy for the clinicians to be able to perform is also critical. So we're really pleased to launch that. And now our team in India is gearing up to support the clinicians with the rollout and launch of that product and the training that's so critical.
So, Stephen, you visited India, and I'm sure you must have heard from many people that India is a very diverse country. And that also brings its set of challenges. I mean, we have inequity of healthcare access in India. You have urban areas, the places you visited, where you have good technology available, best of doctors that people have access to. But just 100 kilometers interiors of India, they may not have technology or the skilled manpower to serve them. Do you think that the newer technologies with facilities of remote monitoring clubbed with dialysis on the go uh, will bridge this gap in the future? And what is your vision to make this happen in India as a part of Vantive?
This is, I think, the really big opportunity that we see is if we can make the therapy simple for patients to perform in their home, um, with remote patient management so that they're getting the oversight from the specialists. And we build in really a care team around that patient that could include their GP as well as the nephrologist. And we have the technology that can escalate concerns and alarms. We believe that it can be far more accessible for the masses. This can be a solution for urban areas as well as rural areas. This is on us to really demonstrate that value and capability to the governments. Globally, we're seeing trends where local governments want to reinvest in their local economies. And we want to see some of this investment go to home therapies. We're seeing the global trend. We want to continue to advocate for the value of home-based peritoneal dialysis. And we think it's a very big opportunity for markets such as India.
Fantastic. Stephen, my last question to you before I let you go is to understand your personal perspective. You worked with company called Baxter, which is a global major a very big name globally, and you spent 19 plus years with that company. How does it personally feel for you to move from there to a new company called Vantive? Uh, what's the opportunity that keeps you excited in this new role?
Well, in a way, it really is exciting because in many aspects, we're leveraging the legacy of the Baxter sale and stand up of our new independent company, which was their kidney care and their chronic business. So we have, the people are very familiar, the teams are in place. We have that $4 billion of revenue, so we're not a small medtech player, but we also are a brand new company, a brand new brand, a brand new vision, a brand new focus on these two areas. And that's really exciting. It's almost feeling like a startup, but we don't have some of the challenges that your typical startup would have. And so we're seeing a lot of energy and enthusiasm as we launch the brand, we launch our new culture and our real focus around vital organ therapies and dialysis. And I think with that focus, we're going to be able to drive further innovation and further care around that patient group.
Stephen, it's been really nice talking to you, and I am, absolutely in agreement with what you said because, when you have an opportunity to create newness around what you have already been doing, it just brings in an opportunity to do things differently. Like you just said, you have an opportunity to create a new culture and a new work environment in which you will be able to serve the same market. I also, sense that there's an opportunity for the government to start looking at bringing attention to PD first policy that we have seen in Thailand also being unrolled. And for company which is already serving 4,000 patients in India, for them it's an opportunity to make a difference by doing things in a newer manner. And I think one responsibility that I feel that companies like yours have is to bridge the gap between the inequities that we see in healthcare delivery, because I keep saying there are these three A's that make a difference. Three pillars. One is accessibility, second is affordability, and third is ensuring that accessibility and affordability is not at the cost of quality. So
Yes.
I wish you the best for what you're doing. You already, for the region that you're managing, is exciting, and I hope that you'll be able to make that difference in India too. Thank you so much.
My great pleasure. Thank you very much.